Part of Team 5 with Ben Bow, Nick Flower, and Laszlo Ring. Throughout the semester, we've been working on Bridge, an app for bringing family members closer together. So the healthcare problem we're focusing on is the graying of America. So the growing aging population in the United States. So in this image, you can see that in 2003, there was 36 million older adults in the U.S., and this number is supposed to grow to 87 million by 2050. So social isolation for older adults and loneliness is a perceived lack of communication for an individual with his friends and family. So where does this feeling come from? In this image, you can see that the older adult experiences the feeling of loneliness from very different sources, but the two main ones are families and friends being too far away or too busy. And this is what we're going to focus on, reestablishing the links between the family and the older adult. So some statistics about loneliness. It's a real problem, and 40% of older adults experience loneliness, and 29% of all non-institutionalized older adults in 2012 lived alone. There's about 1 in 5 adults by 2030 that will be 65 years old or older. The health outcomes for that is going to have a very severe impact on older adults. There's a 3 times greater 5 years mortality rate for older adults that experience loneliness. There's also an increased risk for cardiovascular disease, and we want social interactions to encourage adults to seek preventative and appropriate medical treatment and better adhere to medication or treatment plans and participate in less negative behaviors. So the solution for this would be Bridge. So what does Bridge do? Bridge facilitates the communication between an older adult and their family members by promoting social interaction and healthy behaviors. So how does Bridge work? Google Glass would act as the eyes and ears of an embodied conversational agent, and automatically records the older adult's daily activities. It would send and receive messages to the family members and remind the older adults of very important tasks. So why is Google Glass a good technology for this project? Is because it is a hands-free device, it has a point-of-view camera, and it is a wearable device with speech recognition capabilities. So here's an information flow for our network. We have the older adult, the family, and the computer agent. And the Google Glass is going to record the location data via QR code. So the older adult is going to send messages to the family via the server. Location data is going to be sent to the computer agent. The family can reply the message back to the older adult, and then the older adult can access that message via a dialogue with the computer agent and reply with a message to the family. So now, if we look at the benefits from either side, so we have the family and the older adult. On the family side, they obtain an activity log of the older adult's daily tasks, like what they've done today, and they are able to answer the messages that they've received from the older adult. On the older adult side, they're able to send pictures and respond to comments from family members and get reminders for very important tasks such as taking medications.
All right, so I'll just briefly go over all the system components one by one and then talk about how they're used in our system. So again, just to recap, the 4 major components we have here are the agent, the glass, which is worn by the older adult, the server, which is the middleman in all the communication, and the mobile app. So the general idea is the glass acting as the eyes and ears again, so it's going to collect all the location data and relay messages back and also listen for the dialogue. It'll go to the server, which then distributes the notifications to the appropriate things, whether it be the mobile app to alert the family members that they have a new message waiting for them, or to the agent. So the agent itself is an embodied conversational agent with synthesized speech. It has voice input and optional text button input if you want, and it's written on a custom XML scripting language with Java backend on it. So that way we can run anything in real time, so we can figure out what it needs to talk about, load up the things from the server, figure out exactly what's going on with that. So what exactly does it do? So it has kind of two major tasks. One's it reads and records the responses from the family members based on the pictures sent to them. And then secondly, it also kind of leaves the stress off the family by dealing with these daily tasks that they would have to otherwise nag about. So based on what locations it sees, it'll talk to them about eating healthily, medication, exercise, and basic hygiene. And this is, again, based on what it sees for the codes throughout the day. So if it sees a location, it'll check it off temporarily, and then after a certain amount of time, it'll come back.
So for the Google Glass part, it serves as a background Android service, and the service, to save the battery, the service will trigger the glass every 5 minutes to scan the environment to find the QR code. And the Google Glass can also be used to take a picture. The picture taken will be sent to the server immediately, and other family member will get the picture in real time. So Google Glass can also get the notification from other users. So if the family member sends some message, the Google Glass will get that message. And Google Glass also used as a voice input for the agent. So the server part is powered by Google App Engine. It's used for facilitate the communication between all three systems, which are Agent, Google Glass, and mobile applications. The server uses GCN for notification sending, and you can control the Google Glass by the server directly from the web browser. So you can control the glass to scan the QR code and take a picture.
So as we alluded to, we have an application that runs on the family's Android devices that can receive notifications whenever the older adult posts any new content, such as pictures or comments that they've already responded to from a previous thread. There's also a location log, which shows the locations that the Google Glass has picked up that the family member has been in, such as the kitchen, or the kitchen, and the kitchen, and the kitchen, and the kitchen. Very hungry, apparently. When you click on a picture, you're brought to this screen, which is an active thread, which displays the picture that the older adult sent to the server and has one message associated with it. This maintains a back and forth dialogue between the older adult and her family.
All right, so just to recap, the problem we're dealing with here is loneliness and social isolation in older adults. The way we're going to solve it is we're going to have Bridge, which is going to facilitate communication between the older adults and their family to promote social interaction and healthy behaviors. And we're using Google Glass in this scenario as the eyes and ears of an embodied conversational agent, which is going to allow the older adult to have a natural interaction with the family members, even though it's not direct, and kind of passing along the scenes. So here's some of the references we have, and on that note, we're going to do a live demo. So for this live demo, someone wants to hold this for me. I will be playing the role of the older adult. So close that off the screen. And then over here, we have the phone running the Android app. And an important thing to note is that it's not limited to just one Android app. You register to the older adult from the family. So here we have actually two apps running it with just different user accounts. So if they sent different messages, then it would happen appropriately. So as I put on the glass, I would just go about my daily day. I wouldn't really do anything special with it. The big emphasis here is we don't want the older adult to have to fiddle around with the glass and try to figure out how to interact with it. So there's kind of only one real interaction they have to do with it, which is if they want to take a picture. So all they do is they tap once, and then they tap and hold. And then what happens is after a few seconds, it'll take a picture of whatever's in front of you, and it'll send that off to the server. The other thing that will happen is that periodically throughout every 5 minutes, we'll send a scan to say, look at what environment the older adult is in. So just so we don't have to wait here 5 minutes, what we do is we have an ability to automatically send it. So here, when I tap it, the QR code reader comes up. I look at that. All there is a quick beep. They don't even need to know what happened there. And now that data has been sent off to the server. So now, if we go over to here, as you can see, that's the picture I just took. And if someone wants to play family member for a second. So what they can do here is now they can type the comment for whatever they wanted to respond to. So this is a little laggy just from the setup, but it's just a normal keyboard, like an instant messaging app that they're So what happens then is that you get a little notification in your ear that says you have a new message. You should go talk to the agent at any point to hear the message. So that's exactly what we'll do right now. So now what we'll do is, assuming that the agent is running on some dedicated computer in the person's home, what they do is they just go over to it and interact with it. So this is voice interaction, so I'm not going to explain too much during it. Oh. And I should put sound in. I'm doing great, thanks. I'm doing great, thanks. From where? Oh, this, oh, I'm at. Could you repeat that? Yes, I did.
Good. I just wanted to double check. You have a new message from your family. Would you like to hear it?
Yes.
This is the picture they responded to.
Okay.
Laszlo Ring said hello, hope it's going well.
Okay.
Do you want to respond to this message?
Yes.
What do you want to say to Laszlo Ring?
I think it's going well also.
Okay, I sent the message to Laszlo Ring. Well, I'm going to let you go back to your day. I will let you know if you received any new messages via your glass.
Talk to you later. And she goes off the screen. And so you just kind of repeat that interaction throughout the day. And then if we go back to the mobile phone, we have the agent said it's going well also. So that's the demo. So any questions? Or? Yeah.
What happens if the person responds something outside of the list over there? Does it still
So what happens, the way the recognition works, is it looks for the response with the closest match to it. And if no match is found, then it'll just prompt the user to repeat the question.
Is there any way to confirm if what you dictated in your response was in fact being transcribed correctly?
So you will actually see it up there, but you could also type it in manually if you think it's going to be extra complex and won't get through.
Yeah, you see the words as after you said it and get the B, it just like shows
Yeah.
up.
And the other thing that's probably not as apparent is the reason I'm pausing for a second is it actually notifies the older adult when to actually respond in the conversation. So as soon as the buttons appear, a beep also appears in the head to tell them it's okay to start responding now.
What would you see as next steps if you were going to continue this, either in evaluation or in development?
So what we focus a lot of our development effort here is to kind of build the framework that we could use to expand forward. So expanded dialogue in a lot of these scripts would be a big area we could do. So putting full interventions in any of the little modules would be an easy thing to do. And also just kind of improving location detection, since there's much more advanced things in QR code reading out there, just to make it more robust and reliable.
Sorry, just on there. So what you see is what we saw up there. But it's
No, so there's actually absolutely nothing up on the glass at almost all times. It's just audio recognition, audio beeping to tell you when to talk, and it's just listening for your voice. The only time anything ever appears on it is when I took a picture and it just shows you the picture before it sends it off. Just to make sure you send it right. Yeah. Yeah.
So this is sort of a silly thing, but you know that commercial, I've fallen and I can't.
Yes, yes.
So that seems something that happens.
Yeah.
With older people a lot, that they misstep or they fall or something doesn't happen. So is there any way
So.
to use the glass that way to do motion detection almost?
So we don't do that necessarily on the glass itself. That's easily something we could add to it. But what we do have is the capability for the family members to force a picture to be sent on the glass. So if they haven't heard from their parent in a while, maybe they can force a picture to be sent, and if they see lying on the floor or something like that, they can know what's happening.
Put a QR code on the floor.
Yeah, yeah, exactly. Yeah.
So that you're saying that the daughter
Yeah, could.
say, take a picture so I can see.
Exactly. And then they would get that picture back on their phone instantly. So, yeah.
I'm curious about some user features that I'm wondering if you considered how they might impact what you did.
Yeah, sure.
So a lot of socially isolated older individuals either have depression
Mhm.
or have cognitive impairments.
Yep.
Seems like those might impact either, for the first case, how well the conversational agent works as really feeling social,
Mhm.
and does the family see that as a real substitute for social interaction, in which case maybe there could be even
Well, so it's not necessarily.
contraindications.
So just to point out, it's not necessarily to replace social interaction. It's just kind of to aid in the transition of it. So especially with someone with cognitive impairments, it would be harder for them to, if you give them a normal computer with messaging apps, for them to go on it and then start emailing off their families and doing stuff like that. Here, this is literally simulating almost as close as you can get to just a normal conversation with someone. So you're just talking back and forth, and all the messages are the ones from the family. So most of the content is just actual dialogue back and forth. There's also another path we didn't go down that if they weren't feeling well, they could also have sent messages to their family members to make sure that they know they're okay.
Right. Did you consider adding sort of the ability to call the family in addition? So I really just need to talk to a real person, and that could be.
So I mean, part of that is kind of already built into the glass since it's already paired to the phone. So you could say something like, call this person on the phone automatically. So that's just built in if they need immediate assistance.
Aren't older people also more inclined to share information with an agent that
Yeah.
they wouldn't otherwise be inclined to share with a real person?
Or, well, just users in general sometimes share more medical information since they feel that the system isn't judging them as harshly. So they might be responding to the questions of did they eat, did they shower, did they do et cetera, more honestly than they would if their daughter was asking them and they say, oh, yes. So. So.
Any other questions or comments? Do you know if anybody has done work with glass and older adults, like how older adults?
Not that I know of offhand. I know work with agents and older adults, but